Hello, I'm going to be answering question 1 about the value of play for the hospitalist child and what role play plays a part of in the toolbox of a child life specialist. So, what is play? Play is an enjoyable or spontaneous activity that a child wants to participate in and wants to engage in to have fun or they have pleasure in doing so. So, a typical play activity could be something along the lines of Uno, a different type of board game, arts and crafts, Legos. These are all normal activities that a child may take part in playing when they are outside of the hospital setting. So child life specialists want to try and integrate these different play activities within the hospital setting to promote normalization and coping skills, to try and have these different play activities within the hospital so that they are familiar to a child when they're inside of this stressful setting in the hospital. So play is something that children experience on a daily basis. So when they are in the hospital, it's important to be able to continue to promote the different development and growth that they would be experiencing outside of the hospital with play and encourage it within the hospital. So child life specialists want to do this by being able to try and minimize their fear and anxieties of the hospital by incorporating play. And different ways that they can do this is also having medical play in the hospital. So medical play can be something that minimizes the fear and anxieties of the child and takes away any misconceptions that they may be having about the between the fantasies and the realities of what's real and what's not real, the magical thinking. So to introduce something along the lines of syringe painting or syringe water guns or gauze painting, to be able to have some sort of medical equipment as play, or to have a doll and allow the child to initiate some sort of role play with you to take away any fears or misconceptions that they may be having within the hospital, to provide it with factual information to what they may be misconceiving of a shot to be hurtful, and with the dollar in the role play and the child life specialist to be able to minimize those fears, to tell them what will actually happen. And these different play activities are really great within the hospital setting to keep promoting different cognitive, physical development, or social emotional development within the hospital, and also be able to allow them to keep hitting these different milestones if they're there for a long stay within the hospital setting.